Hello and welcome back to Gracie Meets. Before we begin the show, I wanted to share a story. My grandma had a stroke recently and ended up paralyzed on her whole left side. When she had to go to the hospital, a physical therapist was there to help rehabilitate her. I was interested in what all a physical therapist has to do for their job, so I invited Mr. Armando Espinosa. Why don't you introduce yourself and tell us about your job?
All right. Well, my name is Armando Espinosa. I am a physical therapist assistant, but my job career is I help people work through their injuries, any diseases, pathologies that a patient that I come across after being evaluated by a physical therapist. And I follow a plan of care that a physical therapist writes up and come up with different exercises within that plan of care. Always got to modify some stuff within the evaluation. Physical therapy has a very wide range of facet of disciplines, not only orthopedics, which just means like joints, such as sports injuries, regular injuries like a sprained ankle or a fractured elbow or anything. We work with neurological disorders and traumatic brain injury, spinal cord injuries, pediatrics. We work with babies and kids and teenagers with a lot of times it's developmental delay or some kind of cerebral palsy from a birth defect. Yeah, so that's kind of what the whole realm. We also work with someone with like pressure ulcers or a burn and debridement to help heal that wound up. So,
Why did you pick this profession over anything you might have been offered or thinking about in college?
I picked this profession because it really goes along with my personal lifestyle and development. I always, as a young kid, was always interested in health and fitness and sports. And I was a runner when I was younger. And then I turned that into a cross-country track sport athlete throughout middle school, high school, and I played baseball within those years. And then I was always interested in helping people, teaching people about just health and well-being and just living a more of an upright life as far as fitness is concerned. And I picked it because it was more aligned with my lifestyle, my interests, and I was actually thinking about different avenues in college at University of Houston main campus. And I was thinking, man, I could be, more business so I tried it out, took an accounting class, didn't like it. My degree was exercise science at University of Houston. And then I went back for the physical therapist assistant program at Houston Community College.
It's cool that you turned your sports into a job. I was a cross-country runner a couple years ago, and now I'm in track. So I think that's really cool that you chose to do that.
Yeah, it's great. I mean, just the way the body works, the biomechanics of how somebody runs, walks, jogs, cycles. So yeah, it's very interesting, and I'm still interested, and I still love what I do.
Who do you think is a perfect fit for this job? Like, is there a specific kind of person that would excel?
To be honest, specific, it really kind of dive deeper into that subject when you're actually licensed. Physical therapy, the whole realm of it is very broad. I feel that I love people. I love helping people. And I integrate that with fitness and staying healthy. And when I was kind of figuring out what I wanted to do after college or stay within my realm of health and fitness, I just thought to myself, what do I like to do? What kind of person have I been so far in leading up to a career? And so someone that has a drive to helping people and helping others that can't help themselves, such as learning how to walk again, learning how to get out of bed safely, how to get up and down from a chair or wheelchair safely, even down to the anatomy of their body on different injuries and surgeries that they may have had or they may have. And so explaining that the educational system to them, that an everyday person wouldn't know, all the medical jargon they've been thrown at by their doctors or nurses, they still don't understand. So at the level of the physical therapy and the physical therapist assistant, my job is to help those patients get through those times of questions. Education is key in my degree. So if you like to teach, you can definitely teach a patient something about what's going on in their body, why they're feeling pain, or what they could be feeling after a surgery they may be wanting to have, or maybe they want to avoid. And so that's why you're there, to help them through strengthening something that's maybe weak. So if you have a drive to teach, if you're into fitness, if you're into any kind of sport, doesn't have to be running. If you're always curious about how things work in the body, how to get back from injuries, I think that broad spectrum of thought can get you to a place of physical therapy. And then once you become into the program, you learn all about the program, then you learn the different facets of physical therapy routes, like working with children or working with sports athletes, or the geriatric population that I work with currently, the older folks, or the neurological disorders, the traumatic brain injury, then those kind of things you'll learn in the program. But as far as that, it's just loving people, helping, teaching, and growing within themselves and others.
I know that physical therapy is in the medical line of work. So how has COVID-19 affected your job? Because I know this is a very hands-on line.
Well, it's affected very heavily, as you'd expect. I was very concerned about contracting this, disease, virus in the beginning. But really, we put on masks, we put on our gloves, we gown up, we ask the questions, the therapists and the nurses that check the patients in to the doctors, they give them a battery of questions like, have you had a fever in the past 7 days or 2 weeks? Or if you came in contact with anyone who had a fever, could be questionable having COVID-19 or anything. If you travel outside the country to the kind of countries that have started the viruses or the most populated, or so there was a huge awareness in the medical community. And personally, I was, definitely concerned to myself because I'm coming in contact with them. And so I wanted to know if I had the virus. I got tested myself in March. Not that I had any symptoms or anything or came in contact with anyone who had symptoms, but I just wanted to know for myself, peace of mind, that I wasn't possibly affecting others. Test came back negative. I didn't have COVID-19 or any sickness at that matter. So, and we have to document, we've been asking these questions, screening every visit, not just one time. We screen every visit. We take their temperatures. And normally we do all that anyways during a visit or before the visit starts. We'll take temperature, we'll take the heart rate, oxygen saturation, and their blood pressure and the respiration. So we take all those parameters, and something's off, we have to contact the agency and kind of follow up. But so far, everyone's been healthy. This is probably the healthiest I've seen all my patients has been since I've started working.
Well, that's good.
Yeah.
How could someone interested in your profession get more information?
Someone interested? Well, number one, your podcast is great. Listening to the segment, to learning firsthand how to get started and what it kind of mindset you have. But I went to the Houston Community College in the medical center, Coleman campus. You can be 18 years old, fresh out of high school. And when people graduate high school early, you can go in once you graduate high school. You have to take some prereqs, but the prereqs are listed on the website. When I went through, they may have changed it now because of everything being turned over. But they would have interview nights or orientations a couple times a month or once a week to kind of get students or give someone awareness of what's in the program, what's all in there. So if you go to the Houston Community College and navigate to the Colmy campus and the medical center and then to the physical therapy assistant program, you don't have to have a degree to get in. Bachelor's, you just have to have, I think, the 5 or 6 prereqs classes, pass those, flying colors. Then you have to go to an interview or go to their orientation, see if you like it or not. If it's your cup of tea, they explain everything was going on in the program, what you see, what you may see, not see. Then you go to the interview program. You have to get some contact hours, some volunteer hours to kind of make sure you want to be in this program and the profession. Once you get those hours done, I believe, I'm going to say it's like 50 hours or 100 hours. You get all that application in with your classes and you apply, interview night, they ask you a bunch of questions, physical therapy related, career related, kind of these questions you're asking me. And so, so that's the biggest thing, the first step, and then you go on to the program.
Well, thanks for letting me interview you. I had fun.
Yeah, you're welcome.
And I know you have a podcast, so if you would like to shout that out.
Yes. My podcast is Houston H-Town Haps. I feature all my cycling and some of my yoga, and I salsa dance. And however, I'm a big bike racer, mountain and road biker, and I pretty much talk about where I'm at in different parts of Texas. Usually I'm out in the middle of nowhere, somewhere in Austin or Waco, or I don't know, anywhere. There's usually little to no internet service, which is great. So that's my podcast. I also have a YouTube channel called Get Mad at It TV, kind of the same concept. So, but yeah, thanks for having me.
Physical therapists definitely have an important role in our society. If no one was there to help people who were injured, there would be tons of family members who wouldn't get to spend time with their friends and family. Usain Bolt or Rob Gronkowski wouldn't be able to do what they love anymore. Our world truly needs people who are caring enough to rehabilitate people with life-changing injuries. No normal person could do something as important as that. But then again, show me a normal teenager. Thanks for listening. Thanks for tuning in. If you like Gracie Meets, subscribe so you can listen every time a new episode is dropped. And follow Gracie Meets on Instagram at gracie.meets. Tune in next Saturday for an outgoing interview with a judge.